So good afternoon. Pulse oximeter it consists of mainly your three pulse. That is one peripheral probe. Okay, peripheral probe means this is okay. This is probe which we are keeping attaching in our finger. So that is a peripheral probe. With the help of this, each and every data which we are collecting, we will get along through this. Okay, a microprocessor unit displays a waveform and the oxygen saturations and the pulse rate. So this is your processor unit. Okay, so here we'll have this is display. Okay, and there have you seen this waveform? This waveform will be displaying these are the one these are the pulse rate of a patient. Okay, and the oxygen saturations and the pulse rate also it will be mentioned here. Okay, so here this is connecting wire connection wire which we have to attach in this peripheral probe, and we need to keep it in a finger. Okay, then this peripheral probe has two lights, okay, which emits the which emits the detector which will work as a detector. Okay, so we'll have red and infrared light. Okay, this peripheral probe consists of red and infrared light which will work as a detector. Okay, these two light will be able to detect the oxygenated blood and deoxygenated blood. So most oximeter also have an audible pulse tone. Okay, in nowadays so many modern apparatus has been coming out where tone, even the audible pulse tone also it is available right after getting the rate, that they will give some tone we through which we can visualize. Okay, so these are the main parts of a pulse oximeter. And again, even uh, even the portable pulse oximeter also it is available without wire, without microprocessor unit, where which we can connect in the peripheral area or the fingers or the other parts which we will discuss later. There, if you will connect it right after 1 minute of checking, then they will display immediately they will display the saturations level of the patient, oxygen saturations level of the patients, and when the pulse also they are showing in the probe itself. There one display will be there where they will show the rate. Okay, this kind of oximeter also it is available nowadays in the market. Okay, next, the principle of pulse oximeter technology, how it is working. Okay, so it is based on the red and infrared light absorption characteristics of oxygenated and deoxygenated hemoglobin. That means it is completely based on this light. Okay, as I have mentioned, those the peripheral probe which we are connecting in the fingers, they will emit this red and infrared light. Okay, which will absorb the your oxygen and deoxygenated hemoglobin. Red will absorb your oxygenated hemoglobin and infrared will absorb your deoxygenated hemoglobin. This is the main characteristics, and with the help of this light only we will be able to detect how much saturations is there in your body, and how much your pulse in how a human being is beating. Okay, the red light is in the 600 to 750 nanometer wavelength. Okay, I think you got this web regarding the wavelengths and all, you have got in the physics, I think. So this red light in the 600 and 750 nanometer they are emitting. Okay, their rate is 600 to 750. In case of infrared light, okay, they are emitting 850 to 1000 nanometer wavelength. Okay, so with the help of this wavelength we are being able to catch up the patient saturations level. Okay, so this is the main principle how it is working with the help of the light. Okay, Pulse oximeter work by placing a pulsating atriovascular band between a dual light red and infrared source and a photodetector. That pulse oximeter, your prop, that finger prop, they are having that, they are placing. How it is working? By placing a pulsating atriovascular band. The surface itself they are calling as a pulsating arteriolar vascular band between dual light red and infrared, and between these two red, okay, this pulsating vascular band will be there. Okay, so there, even they have a one photo detector also. So when you'll place it there, the red light will able to detect your oxygenated blood, and infrared will be able to detect your deoxygenated blood. So like that, it will be able to catch up your saturation level, and the photo detector record the relative amount of each color absorbed by arterial blood and transmit the data to a monitor which display the information with its heartbeat. Yes. So as I have seen in the photo, in the previous pictures, that monitor they are having, those graphical presentations, and the rating also they are giving, right? So photo detector they will record the relative amount of its blood, okay, which will display the information which of your each heartbeat, how much, how the patient is breathing, and with the help of that we'll be able to detect the pulse rate. It is generally measures on these are the sites. Various sites are like the finger. The mainly basically we are keeping it in your thumb finger. Okay, even your toe, the great toe, you can keep it. You can also attach this peripheral probe, pinna, or lobe of the ear. In case if you're not getting, then you can even keep in your pinna your ear, right? And in case of infant, in case of baby, where you can keep it, the bridge of the nose you can keep it. But generally, very commonly we are keeping it in your foot, the great toe of your foot, or the palm of the hand, and the big toe or the thumb. Yes, generally we are keeping out there. So these are the basic sites of checking your pulse with the help of your pulse oximeter. Okay, I think you are understanding about the topics. So these are the pictures I have collected for you for your better understanding. This is your fingers, right? Yes, this is your peripheral probe. Okay, how you are attaching? Have you seen? These are the bats, particular bats, and have you seen? These are the lights. It's getting emitted. This red light and infrared. So both will able to detect your oxygenated and deoxygenated blood. Okay, so this is called as your vascular bed, which has red and infrared color light. Okay, with a minimum wavelength, which we have already discussed in the previous slide. Okay, so this pulse oximeter, we are keeping it in your pinna. This is your pinna. Okay, and this is your monitor where they will show the your saturation. This is your saturation level 98 degree. This is a pulse rate, and these are the wavelengths. Okay, and have you seen we can even connect in the toe. Okay, so in case of baby, say, we can connect in the foot or the toe. Okay, this is how. Okay, these are the some pictures in the common site where we can place it. Generally for the adult we are always placing in a finger, and in a baby toe or the great toe of their feet. Okay, so advantages, what are the advantages? Yes, various advantages are available which we will check. A pulse oximeter is useful in any setting where a patient's oxygenation is unstable. Yes, of course, if suppose a patient is getting suffocated, they are not able to breathing properly, a pulse oximeter is one of the devices which give you instant record of your oxygenation level in the patients, whether they are having enough oxygen saturations in their body or not. If they are not having enough oxygen saturations in their body, then immediately we have to connect them with a artificial supply of oxygen. That is why it is much important to keep along with the patients those who are having breathing difficulty or any kind of lungs or heart diseases or any kind of major disease, history of major disease. Okay, including intensive care unit SIUs. These are the SICU, CTICU, and PICU, NICU, etc. These are including intensive care. Intensive care means your ICU, right? I have already discussed before. In the ICU, all the patients, those who are admitting in the ICU, always we are connecting all those pulse oximeter, BP cuff. Always we are recording them, because at any time they might get, they may get fluctuate. Okay, if it is getting low, immediately we have to connect them in the oxygen. That is why it is very much important, even for the ward patients also, those who are admitting in the ward, those who are having any kind of diseases, even in the home also we can keep it as for safety measure. Okay, operation theater and recovery rooms. Yes, absolutely. Operation, during operations, right after giving right after operations, when we are keeping the patients in recovery rooms, there also we have to check very frequently for the to know the patient saturations level. Emergency or casualty, a patient suppose mitigated RTA, your road traffic accident, then in there where they are getting uh, going to the they are going immediately to the emergency department of your hospitals, right? So our first duty is to check the vital sign along with the saturations level. If the vital signs is normal, okay, fine, we have to give them first aid care. If their oxygen saturations level goes down, immediately we have to connect them in the oxygen. Hospital word setting, as I have already discussed, even in the word setting also we have to keep it. And determining the effectiveness of need for supplementing the oxygen. Yes, of course, it is determining the effectiveness of need for supplementing the oxygen. Nowadays, I'll give a simple example. Nowadays, which diseases we are facing, we are facing the COVID disease, COVID-19, right? Even in the COVID-19 also, what is the main problem? Patient oxygen saturations goes down. That is why one your uh, advice has been given from the government itself, even from the doctors itself, to keep the pulse oximeter along with you to check the oxygen saturation level. If you are having if you are home quarantine, if you are quarantine yourself in the home after detecting COVID-19, suppose those patients are non asymptomatic, they can stay in the home, but if their saturations level goes down, immediately they have to go to the hospital for the oxygen level, because why? It is directly attacking your lung. That is why we have to check the saturation level. And how we can check the saturation level? With the portable devices like your pulse oximeter. So these are the basic advantage of your pulse oximeter, which is very much useful things, and very much emergency care in among the patient. Okay, so in this video we have learned only till the advantage. In the next video we'll learn about its how we have to handle, what is our roles being a nurse and all those things. Okay, so uh, stay tuned for the next video.